So let me discuss the multiple choice questions in the topic of the cardiac murmurs. You see this clinical scenario. We have a 63-year-old male was admitted to the accident emergency 2 days after the discharge following apparently uncomplicated MI. So he had an MI, uncomplicated MI, and he was like stented and discharged. He complained of, like 2 days after the discharge, he came to the emergency department. What was the complaint? Rapid onset of worsening shortness of breath over the previous 48 hours, but no further chest pain. Okay, he was having rapid onset breathlessness, tachypnea and regular pulse of nearly around 110 per minute, which proved to be in sinus tachycardia. JVP was raised and pansystolic murmur was noted. Maximal at the left sternal edge. Which of the following is the most likely diagnosis? Mitral incompetence, ventricular septal defect, aortic stenosis, Dressler syndrome, further myocardial infarction. So the answer to this question here is, you take what is a murmur which is being heard? Pansystolic murmur. And this pansystolic murmur, you will have that in MR and as well as in VSD and TR. TR though anyway is not given in option. Now what are the complications that is anticipated in case of myocardial infarction? Both of these complications are anticipated in myocardial infarction. You will have MR mainly in case of your inferior wall MI, or anterior wall MI, you can have this MR. VSD usually come across this in case of the anterior wall MI. Okay, but what is very important point which is suggestive of the diagnosis is, you are having the pansystolic murmur which is heard in the left sternal edge. You take the MR murmur. MR murmur, it is heard at the apex, right? Whereas VSD murmur is the one which is heard at the left sternal edge. Okay, so the answer is the ventricular septal defect. And this ventricular septal defect which has developed as a part of your myocardial infarction, that is what is responsible for your sudden onset dyspnea and making the individual to come to the emergency department. Okay, so the answer is the VSD. In mitral incompetence also you will have pansystolic murmur, but that is heard at the apex. And even in case of mitral incompetence, the patient can present with sudden onset dyspnea, right? And in aortic stenosis, the murmur that you will listen is the ejection systolic murmur. Dressler syndrome is what? It's a post-myocardial infarction pericarditis. In case of Dressler syndrome, you don't listen any murmur. Whereas further myocardial infarction, right, you don't have any murmur until unless if you have any valvular pathology or septal defects even upon further myocardial infarction also. So the answer here is the ventricular septal defect.